We continue with Medical Monday this morning. If you didn't know, April is Head and Neck Cancer Awareness Month. In the sponsored segment this morning, Dr. Jeffrey Hoteling, Head and Neck Cancer Oncologist with the Karmanos Cancer Institute at McLaren Flint, joins us live in studio this morning to talk about the importance of raising awareness. Good morning.
Morning. Thank you for having me.
Yes, good to see you. You know, first off, let's talk about head and neck cancer. It's something really you don't hear too much about. Why is it important to talk about it?
Well, these aren't very common cancers, but obviously the head and neck contains, your mouth, your throat, your voice box, all these things that help us interact with the world, which can have a profound impact on your quality of life. The earlier we catch these things, the better patients are going to do. So we really want to increase awareness about these cancers. Sure.
Well, and as the expert on the topic here, what are those most common types that you see?
So I see everything basically from the clavicles, the collarbones, all the way up to the head. And anything from thyroid cancer, parotid cancer, and then the more common things like tongue cancer, voice box cancer, throat cancer. So pretty much everything under the sun between those areas.
Well, what should folks be looking out for? What are some of those top symptoms that people should be made aware of?
Well, what I like to tell patients is really any symptoms in the mouth or the throat, difficulty swallowing, painful swallowing, changes in voice, or a neck mass that gets larger, and doesn't go away within 2 weeks should really be evaluated by your primary physician, and they can make referrals as needed.
And let's talk about, who's most at risk here. What are some of those risk factors involved?
So classically, the most common risk factors are smoking and drinking, so alcohol and tobacco, as they are for a lot of cancers. But more recently, particularly in the tonsils and base of tongue, actually the HPV virus has been found to be causing a significant proportion of these cancers.
And then talk about mitigation here. What are those treatment options?
Well, once you're diagnosed with cancer, I think everything depends on the stage of the cancer. But typically in the cancers I deal with, it's a combination of surgery, radiation and chemotherapy, sometimes surgery first, sometimes surgery kept in the kind of side to see if the other treatments are going to take care of the cancer, but some combination of those.
Well, and then, talk about your role in treating these. I mean, you're there along with the patient every step of the way, right?
Every step of the way. I like to tell them that I hope you like me because we're going to be seeing each other for a long time. The typical follow-up, even after they're done with treatment, I'll see them every 4 to 6 weeks for the first year, and we basically double that every year, so it's a long-term relationship.
Well, and again, overall, what is your message to folks when it comes to head and neck cancers? I mean, the treatability there, the survival rates, talk about, like you said, if you catch them early, it's probably good news?
It is. If these things are caught early, sometimes we can just do a surgery, which is, I kind of describe it as an inconvenience for a patient, and they can do very well in the long run. But with all things, the earlier we catch it, the better they're going to do.
All right. And then finally, how can someone newly diagnosed schedule a consultation with you?
So the easiest way to do it is to call 1-800-KARMANOS, and they'll be able to get in touch with us and schedule appointments with any specialist.
Yeah, there's the number you see there on your screen, the website as well. Again, April, Head and Neck Cancer Awareness Month, and we really do appreciate your insight on the topic.
Thank you for having me.